So the star procedure is the indication of the such a situation. If you are not expertise about the star procedure, or you have not explained about the star procedure, please do not do the MIPH surgery, because this patient definitely will have a more complication after the MIPH, because you are giving some one constriction and internal mucosal further prolapse, and now this is a fibrotic band which gives a more problem to the patient. In this scenario, you abandon the surgery, or you do the only the laser surgery, or you do the only the closed hemorrhoidectomy surgery, and later on you can explain that I have done your pile surgery, but there is an internal rectal prolapse which may be the culprit of your constipation, and later on you further may require a surgery about the rectal mucosal intussusception. So this is the criteria of, or the limitation of the MIPH. That means you can't do this MIPH in a full thickness or larger internal rectal prolapse. If you are doing, then then disadvantage, or the this result will not be gained. Okay. Now, in this prolapsing piles, the role of the star, in a many with the many discussion with the Dr. Longo, with the some messaging, as well as in one group, or in a personal meeting, one or two personal meeting in conference, I gain answer that if we are doing the star procedure instead of MIPH, is there any major disadvantage? According to me and according to him, and with the, some my experience, there is a no big disadvantage or the complication of doing star instead of MIPH. But if you do the MIPH instead of star, there will be definitely a problem. So doing a star instead of MIPH is not a problem, but the problem is the major resection and the cost. But in compared to that, there won't be any stricture formation, which is the most problematic in MIPH, and one of the most common complication of fibrotic ring formation in MIPH, which is not occurred in a star procedure. As well as second thing, the star procedure is resected the larger redundant mucosa with the wall, so the evacuation problem will be improved, which is a very hidden problem all the piles also. So there is definitely a debate about the star procedure in instead of MIPH, but I definitely recommended the star whenever it is need on free hand. You do the star procedure instead of MIPH. Many times in a female patient, I found there is a large anterior, mild to moderate anterior rectocele with the piles. Okay, and I have pre-op explained about the MIPH, but whenever I examine and I goes inside, examine inside under anesthesia, then I found there is a large or moderate rectocele, which is male culprit for the constipation. And then there will be a small internal piles or piles. Then what to do? In my experience, I am telling my experience and what I am doing, that I am doing the only the anterior star, that is the anterior half, that means the 50% of the star procedure, and I have a laser. That's why I'll do the laser ablation of the posterior wall. That means only 7 o'clock position, the piles. Okay, so this may improve simultaneously laser, simultaneously piles with the anterior rectocele. Now coming the painful and the last degree of the piles, or situation of the piles, not the last degree of the piles, that is prolapsing non-infected piles. Okay, the larger prolapsing non-infected, that is a 4th degree circumferential piles. In this situation, I will explain about the star procedure first, and then if it is a non-affordability, and then I would go for the Chivte procedure in this situation. And with the Chivte procedure, I will do the laser ablation of pile mass. Because the Chivte procedure has a tendency to reprolapse back after 3 to 6 months. So I'll explain about that. Fibrosis definitely occurs, but it is a fixating procedure. So some part 25 to 30% is chances that reprolapse come back. So patient is explained about this mild reprolapse, but with this Chivte procedure as well as hybrid technique of laser ablation of piles, the piles treatments becomes 100%. Okay. What about the star procedure? Yes, this is the first choice of a star whenever there is a circumferential large prolapsing non-infected piles. Okay. Now another situation that about the circumferential large fourth degree piles with edematous and some infection. Okay, now in this situation, further, my recommendation is the examination under general anesthesia, and I'll take a decision according to my need. That means the star procedure or the Chivte procedure or the MIPH. If it is a larger redundant above mucosa which is pouting inside, then the star procedure. If it is a lower, only the lower mucosa, on the swab test, if the swab is not catching inside the mucosa, the only the mucopexy, either Chivte procedure or either the MIPH may sufficient. And with the residual pile mass, you do the laser ablation. But whatever the infected pile mass, you have to excise either laser or the handmade, whatever you need. So the infected pile mass I will not keep inside with the any procedure. Sometimes if it is a larger infected pile mass, and many people are worried about the doing the stapler procedure, and this anal canal also not prepared well, then you do the simple hemorrhoidectomy and explain about the some prolapse residual. This is also sufficient. Okay, and doing a hemorrhoidectomy on initial base, you will definitely see there is a large edematous. There is a no result of hemorrhoidectomy. No, it will definitely will give you the result after 2 to 3 weeks. So don't worry about its result. Now many senior peoples are telling me about why this newer technique, why not the hemorrhoidectomy, which is old and gold. I believe that hemorrhoidectomy is the 100% sure technique for vanish of pile mass. There is no technique, even MIPA, star procedure, the laser procedure, the hemorrhoidectomy has a 100% result about the vanishing of pile mass. But nowadays, because of the scenario, because of the demand of the patient about the minimal invasive, as well as the patient is not ready for stay at home, the patient's pain tendency is also very decreased. That means acceptance of pains is also becomes very less. So that's why the adding of this minimal invasive may improve in this scenario also. As well as in old days, there was no concept about the mucosal prolapse, and whenever the patient is coming to you, the patient is always gives you the history about two things. One is the bleeding PR, second thing about the inability to evacuate. Okay, so we were treating about the pile mass. On after the surgery also we are asking about how is your piles, that means, and we are looking about the surgical wound, but we never ask how is your evacuation problem. So we are not dealing with the this evacuation problem in the past, but now new theory is coming about the evacuation problem, that means about the constipation. So if adding of this newer technique like a MIPA star or the GUTA process, if we are able to improve the evacuation problem, that means the constipation problems with the minimal excision, then we are very much happy to give about the result of the piles. But if patient is asking you that, sir, I don't want pile never in my life, then do the hemorrhoidectomy. It gives a wonder result about the abolition. There will be a smooth flattened mucosa after long term many years. There won't be any problem. But if patient is ready for the mild pain, mild discomfort, not a big thing, but mild discomfort, and if evacuation problem is there, that means a rectal mucosal prolapse is there, if he is ready, they are ready, then you do the hemorrhoidectomy. There is no problem of doing a hemorrhoidectomy. Laser itself a very painful condition, so alone laser it's a very painful condition. So explain about the pain in a laser procedure, as well as explain about the mucosal residual prolapse. That means because the laser will work only on the pile mass, not the mucosa, so residual pile mass definitely remains same, the evacuation problem remains same. The GUTA procedure, it's a very cheaper one, as well as but the reposition, the constrictive effect over the piles, the residual pile mass is occurring more, so it's upon you. The MIPH is having a problem of the cost, technical issue, or the some if there is some surgical error, there will be a grave complication can be happen. So according to your expertization, MIPH can be performed. What are the disadvantage of MIPH? Is the definitely it is a higher reposition of anal cushion, so there will be definitely some residual pile mass after the surgery. Inadequate donate is also a problem. So according to me, if you want to do the MIPH or the GUTA procedure, you have to do with some hybrid technique, that means either the laser or with the hemorrhoidectomy to give the best result. GUTA procedure or the MIPH is mainly for the treating the evacuation problem simultaneously with the pile surgery. Many times, many patient friends asking me that means you are doing always a hybrid technique. No, it's depend upon the condition of the poroperative condition or the pile mass, the chronicity of pile mass, the expectation of the patient. I'll do the hybrid technique many times, or most time also I am not doing the hybrid technique, that means the laser or the excision, never do. It's depend upon the condition of the patient, but my choice is the hybrid technique over the all the procedures. Okay, now the solo laser I explained, solo MIPH I explained, solo GUTA I explained, and whatever the star procedure. Star procedure is on debate, so I'll not do. I'm not recommending that every pile patient has to go with the star procedure, but I am saying that please keep on eye about the mucosal prolapse. If it is larger mucosal prolapse, then this is not an indication of other procedure. Go with the simple hemorrhoidectomy. Star is the choice. If you are expertization, then definitely do the star procedure for the evacuation problem, not the piles. Okay. Now the peoples are confusing between the pile surgery and evacuation. That means the surgeons are asking, sir, what about the piles? See, if you are doing the MIPH and if you are thinking that 100% regression of piles, no, it may not be possible. 100% regression of piles with a laser, yes, it is possible, but it will not improve your mucosal prolapse. 100% regression of piles in jute, no, not possible. It is improvement with the some part of pile mass, some part of mucosal fixation also. If you say the hemorrhoidectomy, the 100% regress, yes, 100% regression of pile mass with the hemorrhoidectomy, but not improving your evacuation problem. So that's all about the discussion about the various procedure of my experience about the pile surgery. If you have any query, please let me know on the comment or send me the personal number message or on a WhatsApp, and I may be helpful about your question also. Thank you very much. Bye.